to take the floor.
Thank you, Ben, and I guess you're going to get my PowerPoint up and running. But can I welcome everybody? Good morning to those in the West, and good afternoon to all others. And it's great to have you on board today for this very important workshop. And I'm just going to spend 20 or so minutes giving you a bit of background, a bit of a reminder, particularly for those new people who are on board, and also a reminder for others who are here as well. So have been with the program for a while. Next slide, Ben. I'm Kungarakan from my mother's side, and Iwija from my father's side, up in just outside of Darwin, and I pay respects to all Aboriginal and Torres Strait Islander people online today, and on whose country we're working in and calling in from. So that's an important acknowledgement, and I should also say that it's more than just the lands that we're on; it's also the seas, and that we as Aboriginal and Torres Strait Islander people claim ownership too. Ben, you changing those slides or what? Okay, next one now. So I want to go through and talk about some of the objectives of this workshop and why it's so important for us. It's
Sorry,
a
Tom,
workshop.
we've lost audio for you.
Sorry? Have you lost audio?
No, not for everyone. We can hear you.
Yeah, I can hear you as well, Tom.
Okay. All right. Well, I'll keep going. Yeah. So the workshop is really focused around people working, our TIS teams working in remote and very remote areas, and one of the key objectives is to create an environment where we can network, we can share strategies, and to develop our capacity so that we can actually build on what we've achieved so far in the TIS program, but also, particularly when it comes to remote and very remote areas, we've got to lift our, well, I shouldn't say just lift our game, but we've got to have greater impact. And I'll touch on that a little bit more. But this workshop is also an opportunity to showcase what's working, so that we can share it amongst our colleagues. And as for those who participated in our national workshop in Alice Springs, well, it would be back 2019 now, our last big workshop, it was fantastic to see all the great resources that people have developed and talk about all the different strategies around around the nation, and particularly in remote areas. And that's what we've got to develop up in this, because the bottom line is, we want to know, and you're the best placed people to tell us and to share that information, is what we need to do to make a difference in smoking incidents amongst our population groups in remote and very remote areas. Okay, Ben. So I just want to take a second now, or not a second, couple of seconds, to just do a revamp. We're in the third year of 4 years of funding of the TIS program, and by June next year is when the current funding ceases. So what we're doing at a national level, and particularly out of Canberra, and the department is doing, is starting to build up submissions to government to look at continued funding for the future. But those submissions and the work that we have to do really needs substance behind it to be able to show that we are making a difference. And a bit later on, Dr. Maddox will give us a bit of a presentation on what is happening in remote Australia, and good news, but also not so good news. But the whole idea, for those that are new to the program and haven't heard it before, you need to get across what the TIS program is about. Thanks, Ben. And under this new version, you'll see that it's really 3 major target areas, or 2 really now, and that's pregnant women and also remote area smokers, what our primary focus is on. And we won't worry about talking about pregnant mothers now, but it'll be on remote area, and that will pick up mothers and pregnant mothers and those who are coming into reproductive age groups. Next one, thanks, Ben. And this is just again a little reminder that behind all of this, and what we really need to do is to look at our data and making sure that we've got good data to be able to present to government, to be able to demonstrate that we are succeeding, and if not, we need to be able to show why it's not succeeding or being as successful as we can. Okay, thanks, Ben. And again, for those who are new, this is just a recap, and I'm not going to go through it in detail, about what the TIS program is about. And it's more than you guys, it's more than me, it's more than Canberra and what they're doing. It's a system. It's a big team effort, and all the parts have got to be able to work together if we are going to make a difference. And so I really urge you to have a look at understanding how you fit in to the bigger scheme of TIS and what tackling Indigenous smoking is all about. And you'll see on the right-hand side that evaluation, and continual improvement are really cores to what we do. And part of what we're doing here in this workshop is continual improvement. Those who are really successful, helping bring along those who are having less success or having more challenges. And it's about that information sharing as how do we make a difference? And that's what it's all about. And if we want to get continued funding, we've got to be able to demonstrate that we are A, putting in the effort, and B, that we're getting some success. Thanks, Ben. And this slide is just a reminder that we've got 2 levels of evaluation: what CIRCA is doing, which is called Part A, and what ANU is doing, which is Part B. The big difference is that the ANU study is looking at the big data and to see how impactful the TIS program is on tackling smoking across the nation. Are we making a difference? And that's so important, because we can't demonstrate to government that their investment of $180 odd million over the 4 years is value for money. Then it's going to be a challenge to secure funding. But I think we can. So I'm pretty confident we'll get money. But will it be as much as we want? Will it be more than what we currently get? Are the questions. But the Part A is really the important one, and that has the biggest impact on you guys, because that's what CIRCA is doing. And some of you may already have been contacted by CIRCA in doing the midterm evaluation. And really, there's only 3 core things we have to look at, and that's implementation, appropriateness, and outcomes. And so, the work that CIRCA, Lena, and her team are doing really is around that. And so you'll see evidence is so important, and that's why we need to be able to focus on it. Thanks, Ben. And look, this slide, I think, is the one that's really the telling slide. And the green, the top one, is remote area, and we can see that it hasn't really had an impact since about 2004-05. Even with TIS coming in 2010 or so, we haven't seen a big reduction in smoking in remote and very remote areas. Whereas in the blue line, which is a non-remote, we're seeing a reduction. And so, that's why we've got to be able to change that green line so that starts heading down. And there's a whole range of reasons, but you guys are in the forefront of making a difference. And it's why it's so important for you to tell us through this workshop and through the evaluation, the data collection, of what's needed. Do we need to do things differently? Are we flogging a dead horse, or what are we doing? Why aren't we seeing those changes? And unless we can do that and give some really tangible examples of what needs to be done, then we might be challenged. Thanks, Ben. I know one of the reasons, and you might recall this slide, and this is just taken off the TISRIC website, and it's a boundaries one. There's more than boundaries in this. This is, there's so much data in this, and the real question is, do you use it for your planning? Do you understand? Do you need to have a lesson on how to use this, how to navigate this, great tool that's been developed up? And and when you look at it, and we ask the question, are we reaching all of our people? Thanks, Ben. Next one. And when we look at it, and I just pulled out the Northern Territory, for example, you can see that in the funding that we currently got and the teams that we've got out there, there's a lot of the Northern Territory that's not being touched, or people haven't provided us with data to show that they're being reached. But big communities like Wadair or Maningrida. Maningrida is getting recently getting some service, but how do we reach those people? All those people around Eastern Arnhem Land or Western Arnhem Land, and all of those areas around Central Australia, other than the big communities, how do we reach those smaller communities and outstations? Thanks, Ben. So that brings up a range of questions. When we look at it, and this is not just for the Northern Territory, but for all of us in working in remote and very remote areas, who are we not servicing? How often do we need to visit an area? It might be a very remote community. There might be a smaller number of people. Do we have to visit them every year? Well, the question is, you tell us. Do you need to visit it every year? Or what mechanisms do you have in place that when you're not there, that the message can still get out there? How long do you need to spend in a community? These are all really important questions that you have to ask yourselves and know the answers to. And then through your reports, tell us, what is and what isn't being serviced. And we rely, and we, I mean the NBPU and the department rely on your advice. And I guess that last dot point, which is, one of the really important one, is what else do we need to do to be impactful? Do we need more resources, both human resources or other resources, to be able to make a difference? Okay, thanks, Ben. Now, you've seen these slides before if you've been around for a while, and that's smoke-free workplaces and community spaces. And these are the sort of areas where we're going to get the big impacts, and working with the Aboriginal organisations, Torres Strait organisations who are out there to make sure that they've got smoke-free policies. The department is working at looking at trying to secure some additional funding to be able to work with ORIC to get some resources out, because that bottom little box shows that people who are in ORIC organisations, and there's thousands of them out there, when the training that they receive is impactful. So we need to link up to that training. You don't have to do it from the field, but the department and the big picture stuff needs to get in there. But also, when we look at the stores, this one here is an Alpa store. We've got all the bush stores. Alpa is very responsible in the control of cigarettes. Some of the other bush stores aren't, because it is a big money earner for some. But it's those common areas, common spaces. And I remember when we went up to Weipa, and how the TIS team had worked with the local government up there, the Shire Council, to make sure all the playgrounds had signage up there about no smoking. It's those common places that we can work with the local councils and to get them to make a difference. Thanks, Ben. And of course, the big one that many are working on in some way or another is about smoke-free homes. And look, this is just some stuff you can read a bit later about it, but the key issue is that we both the active smoking and secondhand smoking has an impact, and we know that those people that have gone smoke-free outside often will bring it home and be smoke-free inside. So that's why it's such an important bit. And then there's also the reference down there to education campaigns and what we need to do. I'm not going to elaborate on it because the next slide, Ben, is one that is we get this information from, and it's a good website, Tobacco in Australia, and it's one that we should be referencing often. That's about mainstream tobacco mainly, but it also has a lot of implication and application for us in the Indigenous tobacco space. And of course, the next one is really about the economic impact of smoking. And this is what we have to really emphasise to people, because it's really a circular issue for me, is that people feel stressed because they don't have any money, so that drives them to smoking for some people. And of course, this means they're spending more money. And so, that means money that could be spent on food or looking after family and whatever. And another click, Ben, because when you look at it, when you look at the Job Start allowance in 2020, if you smoke a packet of cigarettes a day, and that's coming from a Bush Stores price, a pack of 20, then you're spending the equivalent of Job Start a year. So Job Start allowance. So you're going backwards. You're not getting any money if you're doing that. So that's a real big consideration. And of course, next one, thanks Ben, that we have to be very mindful of e-cigarettes and what's happening. You've seen this slide before. There's a link there. You can go and have a look at it. But we need to really monitor and understand the impact of vaping, e-cigarettes out in our communities and discourage that as much as we discourage smoking. Thanks, Ben. And I've mentioned before about the TGA, Therapeutic Goods Administration, have been looking at e-cigarettes and vaping, and particularly nicotine-based e-cigarettes. They've now, they've said for quite a while that there's no real evidence to show that e-cigarettes are a harm reduction approach, and so they haven't approved anything. And particularly their latest bit of research has been around nicotine based e-cigarettes and devices, vaping devices. And next click, Ben. And what they've done is that come up with a determination that from the 1st of October this year, that nicotine-based products, e-cigarettes, can only be administered through a doctor's prescription. And they're going to start a big public information campaign. We'll also do a fair bit to keep you informed. Anita, the branch head, and myself have been working with TGA to look at different ways to reach out people, and particularly you guys, to inform people about the TGA's position. All right, thanks, Ben. And today, for those that didn't know, is World Hearing Day, and it's a day where it's themed this year, Hearing Care for All. I participated this morning in a launch of the first world report on hearing. That was at Macquarie University, which has a big hearing centre, and there's a whole range of videos that, it's actually going live at 2 o'clock. So in a couple of minutes' time, it'll all be going live of what we did this morning. But I'll circulate the link in the next NBPE newsletter, so you can have a look offline at it. Thanks, Ben, because I think, and I'm not sure how many of you guys know, but most people don't understand the impact of smoking on hearing. And for our mob, Aboriginal and Torres Strait Islander people, hearing loss from a very early age is very significant. And as you can see in these, and I won't go through them all, but in utero, smoking can have an effect on a child, a baby, and even before they're born, that they can start to develop hearing loss. And the key thing in all of it is that, where there is, hearing challenges at a very early age, is to go in and get the medical advice on that. And that way, and I talked this morning that when we look at the justice system, we look at the education system, our kids are failing, they're getting kicked out because they're being humbugged in school. Often it's because they can't hear. And so it's a health problem, not an education problem. They get involved in the justice system at an early age and all the way through. And so there's a correlation between smoking and hearing loss and how it impacts on our mob because of the high incidence of smoking, which is much greater 39% amongst Aboriginal and Torres Strait Islander people versus less than 14% for the general population. So that's why we're overrepresented. And like one study of a jail of the Aboriginal and Torres Strait Islander inmates, 94% of them had a mild to acute hearing condition. So that just shows you the relationship between getting in jail or offending and hearing loss. And we could say that it's back to smoking. Anyhow, next one, Ben. I won't rant on about that one. But just a reminder that this year, World No Tobacco Day, the theme is to commit to quit. It's on the 31st of May. We need to really look at how we can utilise events like that to really promote the work that we do and get a lot of effort. And as I said in the last MVP newsletter, we missed out on the 10-year anniversary last year, but this is a great year to help celebrate, the successes of the 10 years. So we'll be coming out to you a bit later to talk about that. And the last slide, Ben, is just a reminder that everything that we've talked about today and what we'll talk about at the workshop, the best way to really progress it is not to leave it behind after 2 half days, but it's to get online on the yarning place and talk about the issues, share the issues, and particularly share successes and challenges so that we can all, progress this together, and also recognise that we have to do our bit, all of us, to make sure that the government, the department has got the resources and the information to be able to put in a good bid, to government for continuation of the program. So it's a bit in your hands, it's a bit in their hands, it's a bit in all of our hands. So let's work on it together and utilise this, these 2 half days to share and to really raise with us what's needed to make a difference. Thanks.